Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. We're going to be practicing Transverse Abdominis-Assisted Thoracodiaphragmatic Breath, or in short, TATD Breath. This is a breath that will employ that tridiaphragmatic action, throat, respiratory, and pelvic levels. It's a power breath, one that supports you and provides strength, stability, and endurance in your yoga posture practice, in your rehabilitation, and in everyday activities. You'll want to find a comfortable seated position on your mat using props. The best ones would be a quarter fold blanket with blocks under the knees as needed. Instructions for the quarter fold blanket are also found in this series. First, feel your belly breath, the AD or abdomino-diaphragmatic breath. You may want to place the hands at the belly to feel the belly expand on an inhale, and return to resting with the exhale. Practice this breath first. Then you'll move the hands to the rib cage, and you will feel some movement there. Expansion of the belly, and some front to back and side to side expansion of the rib cage. Next, we're going to use a bottom-up approach. To practice power breath, you'll feel the belly button kind of drawing up and in toward the rib cage slightly, as if it's coming up towards the spine, not rigidly, but with a sense of firmness. At about 25% of what you feel your maximum strength is there. You'll know you're doing it right if you feel the waist draw in when you do that, and the pelvic floor will slightly lift or engage with it, lightly and not rigidly. And what you'll see is a big difference here as you watch the breath. The throat, the thoracic diaphragm will remain at ease, with no restriction through the throat or the skin of the neck or the vocal cord area. You'll feel a difference in expansion. The belly will expand slightly less, and instead, the rib cage will expand more out to the side, laterally, and to the back, posteriorly. So there will be back expansion and rib expansion, kind of like fish gills. The length and the depth of the breath will remain the same. And as you practice, you'll be more fully utilizing or using the respiratory diaphragm. You can release that, go back to a regular belly breath, and try again. Lightly lifting the pelvic floor and the belly button up towards the rib cage. You begin to feel the rib cage expand out to the sides and out to the back like fish gills. This practice will assist you in your everyday activities and exercise, including yoga posture practice, where you need strength and stability. You can practice it every day, and especially during those tasks when you need that stability or when recommended by your healthcare provider. Thanks for joining me.